For this family, Pfizer asking Health Canada to approve their vaccine for younger kids felt like one step closer to peace of mind.
It's news I've been waiting for and my family's been waiting for a very long time. In fact, when my son heard about the approvals coming to Canada, he actually cheered. And he's 9.
Many Canadians share her excitement. A new survey by Angus Reid of 812 Canadian families says about 50% of parents say they will vaccinate their kids as soon as the vaccine is available. But almost a quarter said they would not vaccinate their kids. But protection for another currently unvaccinated demographic could help contain the virus.
That means that possibly in the future, instead of having a large fifth wave, that there could be, slowly an end to this.
Even if approved, officials are cautioning against using the existing stock of Pfizer, which was dosed for adults.
I think that drawing up pediatric doses from the existing vials is not something that is recommended at this point for a number of reasons.
Getting pediatric doses could take until the new year. Despite that, some provinces are hinting they're already planning the rollout.
All done.
Yes, it certainly is a possibility to have something like a mass vaccine clinic at a school, not necessarily during the school hours.
I will say that it will mostly be done by the immunizers that are experienced in providing vaccine to children in clinics.
All of this hinges on Health Canada's approval of data from a vaccine trial that had smaller numbers. The agency is now poring over safety and efficacy data, weighing benefits against risks. The decision thought to be weeks away. Sumanac-Johnson, CBC News, Toronto.
Okay, now we've got Dr. Jacqueline Wong joining us, a pediatric infectious diseases specialist at McMaster Children's Hospital. Because, Dr. Wong, how urgently do you think parents should be approaching this question of should I get my child vaccinated?
Right, because we're assuming that, it's going to get approved and it will be safe for use. I think what parents need to consider is what is the risk of this infection to their child, right? Like, does their child have an underlying condition that predisposes them to a more severe outcome? And who else lives with the child? Who else looks after the child? So, what is the importance of preventing an infection in your child, even if it is mild? What is the importance of preventing that infection on the other household members and family members?
And if enough kids get the shot, does that get us meaningfully closer to this, idea we've all heard a lot about, herd immunity?
Certainly immunizing children is going to close that gap, but it's important to realize that children throughout the pandemic have not been major drivers of transmission throughout the different waves across different countries around the world. And so, even though we can increase the number of people that are immunized, it might not translate into significant decreases in transmission or the end of the pandemic. We have to consider global control of this pandemic. We have to consider, waning immunity and how the transmission will change going forward.
It's a long road back to normal, that's for sure. Dr. Wong, thank you so much for your time.
The pleasure is mine. Thanks for having me.